12 signs of liver disease you can see. You probably don't think about your liver that much. It doesn't beat like your heart or ache like your back. It just works, quietly, constantly, processing everything you eat, drink, and breathe, without asking for credit. But when your liver starts to struggle, it doesn't always send out obvious signals. There's no siren, no pain that stops you in your tracks. Sometimes it just leaves clues, little ones on the surface. A yellowish tint in your eyes. A strange itch you can't explain. Tiny red lines on your skin. Things you might not even notice. Or worse, things you do notice, but brush off. In this video, we're going to slow things down and really look. Because your body has a way of speaking. And when the liver's in trouble, it often shows. These are 12 signs of liver disease you can actually see. Some subtle, some strange, but all worth paying attention to. 1. Yellowing of the skin or eyes, jaundice. Let's start with one of the most noticeable and most telling signs. Yellowing of the eyes or skin. You wake up one morning, glance in the mirror, and something feels off. Your eyes look warmer than usual, not bloodshot, not tired, just slightly yellow. It might be so faint you second-guess yourself. But here's the thing. When the whites of your eyes start to turn yellow, that's not nothing. That's called jaundice. It happens when your liver isn't processing a substance called bilirubin properly. Bilirubin is what's left over when red blood cells break down. Usually, your liver filters it out and gets rid of it. But if the liver is damaged or the bile ducts are blocked, bilirubin builds up in your body, and that yellow tone starts to show on your skin and in your eyes. Jaundice isn't just about color. It can come with fatigue, dark urine, and pale stools. But even on its own, that yellowish tint is reason enough to pay attention. It's one of the liver's clearest visual warnings that something isn't right. 2. Dark-colored urine. Let's talk about your urine for a second. Not exactly dinner table conversation, but it can say a lot about your health. If your pee is dark in the morning, that's usually normal. You've been sleeping for hours, not drinking water, and your body is just concentrating waste. But if it stays dark throughout the day, even when you're drinking enough water, that might be your liver trying to get your attention. When bilirubin builds up in your bloodstream, your kidneys try to help out by flushing it out through urine. The result? Amber, tea-colored, or cola-like urine that doesn't lighten, no matter how much you hydrate. It's easy to mistake it for dehydration. But here's the difference. Liver-related dark urine doesn't come and go. It lingers, and it usually shows up alongside other symptoms, like jaundice, fatigue, or changes in your stool. So if your urine has taken on a darker, unusual shade, and it's not clearing up with fluids, don't ignore it. It might be more than just not drinking enough water. 3. Pale or clay-colored stools. Let's move on to something that's easy to overlook, your stool. Not the most glamorous topic, but definitely one that can give you clues about your liver health. Your stool should usually be a rich brown color, thanks to the bile that's produced by your liver and stored in your gallbladder. Bile helps break down fat during digestion, and it's what gives your stool that normal brown hue. But when something's off with your liver or bile ducts, your stool can start to change color. It might go pale, gray, or clay-colored, almost like you're looking at a blank canvas. So what's happening here? If your liver can't produce or release bile properly, it can't make it into your intestines. Without bile, your stool loses that normal brown tint. This can be a sign of liver damage or a blockage somewhere in your bile ducts, which may require medical attention. It's easy to brush it off if it happens once or twice. But if you notice pale or clay-colored stools regularly, it's a sign that your liver may need a little extra care. 4. Swelling in the abdomen, ascites. Now, let's talk about your belly. You might think you're just bloated after a big meal, but if your stomach starts swelling for no clear reason, there could be more going on underneath. When the liver is struggling, it can't properly manage the balance of proteins and fluids in your body. This can lead to a buildup of fluid in your abdomen, a condition called ascites. At first, it might just feel like a little discomfort, a slight tightness, but over time, that swelling can become noticeable. Your clothes might start fitting differently, or you might feel like your stomach is full, even if you haven't eaten much. This fluid buildup happens because your liver is unable to make enough albumin, a protein that keeps fluid in your bloodstream. Without it, the fluid leaks out into the abdominal cavity. If it's severe, it can even cause shortness of breath or pain when you try to move. Ascites doesn't happen overnight. It's usually the result of long-term liver damage. But if you notice your stomach swelling up for no obvious reason, it's something you definitely want to get checked out. 5. Easy bruising and bleeding. We've all had moments where we've bumped into something and ended up with a bruise, or cut ourselves in a way that takes longer than usual to stop bleeding. But if you notice bruising or bleeding happening much more frequently or without much provocation, it could point to an issue with your liver. Here's why. Your liver plays a crucial role in producing proteins that help your blood clot. These proteins are essential for stopping bleeding when you get injured. When the liver isn't functioning properly, whether due to liver disease, cirrhosis, or another condition, it can't make these proteins as effectively. This leads to a situation where even minor injuries can cause you to bruise more easily. You might notice that simple bumps result in large bruises, or that cuts or scrapes take longer to stop bleeding than they normally would. In addition to frequent bruising, you might also experience other signs of bleeding problems. For example, you might notice that you're more prone to nosebleeds, or that your gums bleed when you brush your teeth. Some people even experience unusual or prolonged menstrual bleeding. These are all signs that your body's clotting ability is impaired, and it's often due to liver problems. If you start noticing easy bruising or frequent bleeding, it's important to take it seriously. While it could be related to a minor injury or something temporary, it could also be a sign of a more serious issue with your liver. When the liver is in distress, it's not just the internal organs that are affected. The ability to manage basic bodily functions like blood clotting can be compromised too. So, if you're seeing a pattern of bruising or bleeding that seems out of the ordinary, make an appointment with your healthcare provider to get checked out. 6. Itchy skin without rash. Imagine this. You're sitting at your desk or relaxing on the couch, and suddenly a persistent itch starts on your arm or leg. You scratch a bit, but the itch doesn't go away. It's not like a typical rash or allergy. It's more like an unshakable, almost maddening sensation of discomfort that doesn't make any sense. No bumps, no redness, just the itch. This kind of constant, unexplained itching could be a sign of liver disease, and it's something many people overlook or misinterpret. When your liver is struggling, it can't process toxins and waste products from your bloodstream as efficiently. One of the things that build up when the liver isn't functioning properly is a substance called bile salts. These bile salts are supposed to be processed and eliminated by your liver, but when that doesn't happen, they can accumulate and leak into your skin. This buildup of bile salts can cause a condition known as pruritus, which is a fancy way of saying itching. The worst part is, it doesn't just affect one spot on your body. It can happen all over, leading to a generalized sense of discomfort, often at night when your body is trying to rest. You might think that itching is a simple skin issue, but when it's persistent, it's worth considering that it could be related to something deeper, like liver dysfunction. It's not just dry skin or an allergic reaction. If the itching is without a rash and doesn't respond to moisturizers or antihistamines, it could be your liver giving you a warning sign. If you're experiencing chronic, unexplained itching, especially if it's been ongoing for weeks or even months, it's important to talk to a doctor. Itchy skin without a rash is often dismissed, but it can be a key indicator that your liver needs some attention. Don't let the itch go unexamined. Your liver might need a little extra care. 7. Spider angiomas, tiny red vein clusters. Spider angiomas, also called spider veins, are small red clusters of blood vessels that appear just beneath the surface of your skin. They're often seen on the face, neck, chest, or hands, and they have a distinctive appearance: tiny red spots or webs that look like they're radiating out from a central point, kind of like the legs of a spider. At first glance, they might seem harmless, just a cosmetic concern or something to ignore. But these little red dots can actually signal a liver problem. When your liver is in distress, it has a harder time regulating the balance of hormones in your body. One of the most noticeable effects of this is an increase in estrogen, which can cause blood vessels to dilate. The result? These small red vessels appear on your skin, creating the classic spider appearance. Spider angiomas are more common in people with cirrhosis, liver failure, or chronic liver disease, though they can also show up in people with other conditions. The appearance of these tiny veins is often gradual, and they're usually not painful or itchy, but they can be a clue that your liver is struggling. If you notice a sudden increase in spider angiomas, or if they start to appear in places you didn't notice before, it's worth discussing with your doctor. While they might not cause any immediate harm, their appearance could be part of a larger issue with liver function. Sometimes, treating the underlying liver disease can help reduce the number of these spots, but the key is to catch it early before things progress further. 8. Red palms, palmar erythema. Look at your palms. Are they bright red, especially at the base of your fingers or around your thumb? This redness, known as palmar erythema, is another visual clue that your liver might not be functioning as it should. When your liver is having trouble, it can lead to changes in your body's blood flow. Specifically, it can cause certain hormones, like estrogen, to build up in your bloodstream. These hormonal changes can dilate blood vessels, which leads to the distinctive redness that you might notice in your palms. This reddening can also happen on the soles of your feet, but it's most noticeable on your hands. Palmar erythema doesn't typically cause pain or discomfort, but it's a sign that your liver may be under stress. It's most commonly seen in individuals with cirrhosis, fatty liver disease, or chronic liver conditions, but it can also show up in people with other health problems. What's interesting about palmar erythema is that it's not something that comes and goes quickly. The redness can persist, and it's often a visible sign of long-term liver damage. If you notice this redness and it doesn't fade after a few days, or if you have other symptoms like fatigue, abdominal swelling, or jaundice, your liver might need to be checked out. While palmar erythema doesn't cause pain or discomfort on its own, it can be a helpful sign that something deeper is going on inside your body. The appearance of red palms is another reason not to ignore any liver-related symptoms that might be appearing. If you're seeing this sign, it's time to talk to a healthcare provider. 9. Nausea and vomiting. If you've ever felt nauseous for no apparent reason, or maybe even found yourself throwing up without eating anything that could have caused it, your liver might be trying to send you a message. When the liver is struggling, whether due to inflammation, infection, or disease, it can cause a buildup of toxins in the body. These toxins can make their way to the stomach, leading to a feeling of nausea. This isn't the kind of nausea you get after eating something a little off. It's persistent and doesn't always seem to have a clear cause. In some cases, nausea can escalate to vomiting. When this happens, it's your body's way of trying to rid itself of toxins that your liver can't filter out properly. If these symptoms go on for an extended period, or if you notice them along with other signs of liver disease, like jaundice, fatigue, or swelling, it's time to take a closer look. Chronic nausea and vomiting, especially when they're unexplained, can be a sign that your liver's not processing waste the way it should. Your body is trying to compensate for its inability to properly eliminate toxins. If this persists, don't wait for the symptoms to worsen. Get checked out. 10. Fatigue. Everyone gets tired now and then, especially after a long day or a week of sleepless nights. But if you find yourself feeling tired all the time, no matter how much rest you get, it could be more than just normal exhaustion. Fatigue is one of the most common symptoms of liver disease, and it can be a real game changer. Liver problems affect your body's ability to function properly, which can drain your energy. When your liver is working hard to process toxins or deal with inflammation, it uses up a lot of your body's resources. As a result, you might feel like you just can't get enough energy, even after a full night's sleep. It's not just about being tired. With liver-related fatigue, you might feel drained and weak throughout the day, making even simple tasks feel like a struggle. This persistent fatigue can leave you feeling mentally and physically exhausted, and no amount of coffee or rest seems to help. If you're constantly fatigued and it doesn't seem to have an obvious cause, like a busy schedule or stress, this could be your liver's way of signaling that it's not functioning as it should. This symptom is often overlooked, but it's crucial to take it seriously, especially if you notice other signs alongside it. 11th, loss of appetite. If you're finding yourself less hungry than usual, or even having to force yourself to eat, your liver could be involved. The liver plays a role in processing and metabolizing food, and when it's not functioning well, it can lead to digestive issues. This might manifest as a loss of appetite, where even your favorite foods just don't seem appealing anymore. In liver disease, the body's ability to absorb nutrients properly is impaired, and this can make you feel full quickly or disinterested in food altogether. The buildup of toxins and waste that the liver is struggling to eliminate can also cause nausea, which further diminishes your desire to eat. In addition, when the liver is under stress, it may produce less of certain substances that regulate hunger, leading to a loss of appetite. If this happens over time, it can lead to unintentional weight loss and malnutrition. Loss of appetite may not seem like an urgent issue at first, but when it's paired with other symptoms, like jaundice, fatigue, or nausea, it can be a sign of something more serious. If you've noticed that eating has become less appealing, or if you've lost weight without trying, it's worth getting your liver checked. 12th, confusion or mental fog. This one can be a little tricky because mental fog or confusion isn't something you typically associate with liver problems. But it's a real symptom that should not be ignored. It's known as hepatic encephalopathy, and it happens when toxins, like ammonia, build up in the blood because the liver can't filter them out properly. These toxins then affect the brain, leading to symptoms like confusion, memory problems, difficulty concentrating, and even mood swings. You might find that you're forgetting things more often, struggling to focus, or feeling foggy mentally. The confusion can be mild at first. It might feel like you're just distracted or tired. But as liver function declines, it can become more severe. In some cases, it can lead to complete disorientation or changes in behavior. This is a sign that the liver's inability to process waste is affecting your brain. If you or someone you know is experiencing confusion or mental fog, especially along with other symptoms of liver disease, it's crucial to seek medical attention right away. This symptom, in particular, can worsen quickly, and early treatment can prevent further complications. Your liver might be one of the most hardworking organs in your body, but when it starts showing signs of distress, it can affect your entire system. The signs we've covered today, like jaundice, swelling, fatigue, and confusion, are all visual and physical reminders that your liver needs attention. If you notice one or more of these symptoms, it's time to check in with your healthcare provider. The sooner you catch liver issues, the better the chances of managing or reversing damage. Always remember, taking care of your liver today can help you